from the 3 months in Andhra Pradesh, 3 Ps are very discussing matter, the PPP, because the coalition government introduced the PPP and although central government also supporting it. But the present YSRCP party is completely opposing the PPP, because why the PPP is opposing by YSRCP? From the BJP government is also it's completely giving support. From now with us BJP state president Madhav is there now. Sir, YSRCP party is fully opposing, and ex-chief minister Y. Jagannath Reddy strongly giving warnings also on media also, because if anyone comes, we will look after 5 years. What is the statement from yours, sir?
The PPP model which the government has thought of is in line with the Niti Aayog recommendation. The framework that Niti Aayog has framed regarding PPP model is design, build, finance, operate and transfer. This is a simple mechanism that is already there in Uttar Pradesh. Around 11 medical colleges, and in Jharkhand around 6 colleges are already in PPP model. A lot of private medical colleges are showing interest in keeping up medical colleges. Andhra got sanctioned around 17 medical colleges during the regime of ICP. Only 6 got on ground. Remaining all 11 colleges, nothing was done. Around 1,500 crores was funded. Around 8,400 crores was required for this all 17 projects to take place. So 11 medical colleges, nothing has taken place. So around 18% of the amount which was envisaged for medical colleges was sanctioned. Only around 1,500 crores was invested. Around 6 colleges, Pulivendala, Adhoni and Aruku, these colleges have been in place, and around 50 seats were given for medical students. These colleges are now operational, but not fully operational. They're only 20% are operational. Remaining 11, nothing has happened. The land acquisition is also a problem in few. So with regard to all these things, the new government under the leadership of Chandrababu Naidu ji has tried to mitigate this problem, and they have adopted the model which was already there in place in Uttar Pradesh and Jharkhand. The PPP model doesn't mean privatization. And this kind of a rumor that is being spread, Jagannath Reddy is trying to create a ruckus in both in state and also in speaking before national media that the PPP model is a privatization model. Nothing has changed at all. Regarding OP, OP will be completely free for all the people, all the poor and vulnerable classes. Regarding IP also, inpatients also, there is a scheme Ayushman Bharat, and also state government is coming up universal health policy. So reimbursement is also there. So people will be having all the free and vulnerable classes who are supposed to have health will be free of cost. Regarding tests and also diagnosis and medicines also, it will be done according to the old norm. Regarding the seats, around 50% of the seats, both in private or public, will be given to government. So here also, the same kind of model will be implemented, where the undergrads seats, 50% will be going to the government. Remaining 50% will be management quota and NRI quota. And the norms of the fee structure and also intake will be done by the state government. So there will be no problem in getting all these things. Regarding PG seats, around 24 seats are envisaged for each medical college, out of which 12 will be government and 12 will be private, and that to be under the norms of the NTR University. So nothing will be going to change. Only thing is the investment of the from the part of state government will be reduced far. And also the management process of running the medical college will look after a much better corporate institution. So they'll be looking after the whole management of the college. So what is there in the whole process, nobody is going to understand. Only some kind of a rumor that is being spread by Jagannath Reddy always has a cue from elsewhere, we don't know. So he doesn't want development to happen in Andhra Pradesh. So not for development not to happen, he's looking for some kind of a scapegoat. And regarding steel plant, he's spoken like that. Regarding this PPP mode also is speaking like this. There's nothing like privatization. It's a old tested formula that is being implemented around the country. It is being taken by Andhra Pradesh, and state government is going steadfast, and definitely tomorrow we'll be seeing lots of medical colleges will be formed under this PPP model, where complete building infrastructure will be built by them. After 33 years, it will be handed over back to the state government if state government want to take and run the institution. So this is what the PPP mode is. Nobody is going to understand this whole process. YCP is going pole to pole to create some kind of a atmosphere against the state government. It has completely failed, and we are going to showcase to people what kind of development is said. In Parvatipuram, nothing is built. He said, "I am going there and showing." In Narsipatnam, he went there, but he got his face off because there's nothing built over there. He went there, he has seen the footings, and he came back. So this kind of thing will definitely happen. It will not help the state's interest. We want the students are going abroad, students are going to other states. This can be stopped by starting medical college around the state. So we will be seeing under the NDA, all the medical colleges are replaced in PPP mode.
Not only PPP, we have to discuss one thing that about the Rishkonda. Then the recent days of the coalition government took a great things about to open the Rishkonda for tourism development. Yeah, how you explain it, sir? What you are seeing about this?
To Rushikonda, the project which was the cottages were there under the AP Tourism Corporation only. Else now also it will be run under AP Tourism Corporation. Now after the YCP Jagannath Reddy has built the palace over there, what to do is a big thing that everybody's wondering, and there's a lot of discussion about how to use the palaces. They're not useful for the hospital. Hotels or not, it is useful for the offices to be run over there. So in between it is stuck. So there was a lot of deliberation, lots of companies have come. Finally, the state government has come up with a plan to give to one of the corporate institutions like some 5-star hotel, where in which the whole premises will be used. Apart from the premises, a new building will also be placed, and it will definitely be a landmark in our Andhra Pradesh tourism project. And in Visakhapatnam also, it will be a tourism destination. So we want not just a 5-star hotel, we want common public to have a look about all the places where it is being built. So we'll be finding out a solution where it was used to the maximum extent possible, so that the public money is not wasted. Around 440 crores was invested for Rushikonda Palace. So this should not go waste. Some kind of a revenue should be generated. So definitely what state government is thinking on the right lines.
So the common guy and a normal voter come from in front of view. If they ask the PPP model, we have to answer them because they votes for coalition government. If they ask PPP, if PPP is for us or not, what do you say?
If PPP is for everybody, it is for the common man, it is common poor. Everybody will be getting benefited out of it, and we'll be having around 17 medical colleges. Nothing like that. So we have around 20,000 our students are going to abroad, to Philippines, to China, to Georgia and other countries. So all these people can come back and they can seats here only, and they can happily study in their homeland. So this kind of a mechanism, by starting all the 17 medical colleges within no time, I think with PPP model we'll be starting within 2 years. All the medical colleges will be in place. We'll be having more than around 6,000 medical seats also, and around more than 200 PG seats also. This is a great benefit for the state. So everybody should welcome it and see that everything comes in place. Even the YCP government, YCP party should also rethink about what kind of rumors they are being spreading. They should look after the development and also the education, medical education that should flourish in Andhra Pradesh.
Sir, few days back, Nataji also reacts about it, and he wrote a letter to AP government also. Is it super short to the YSRCP?
Yes, definitely, because Naddaji was one who promoted this design, build, operate and transfer. This kind of a model was promoted by Niti Aayog, and Naddaji has promoted it as a health minister, and state government has taken the cue of it, and we are running it. So this is a great benefit for both the state and the center also. So we'll be having lots of medical students coming, all the doctors getting placed, lots of employment will also happen. So everybody should welcome it.
These words from AP BJP President Madhav regarding the PPP model 3 Ps, and this is Naresh from Newsx from Andhra Pradesh.